Mr. Marco Salib from Lnkr. Please, 4 minutes.
Thank you so much. First of all, I would say much about the fragmentation, the healthcare industry, as we all know. The industry is a little bit complicated by nature, but I just want to emphasize two main things. As you might know, there is a purely disconnected workflows, especially when it comes to the connection between the providers and payers. This is a real pain. This is hugely reflecting on the patient journey. What we're trying to offer here at Lnkr is we actually have already built an infrastructure layer, or we would like to call it an interoperability layer, spanning 7 platforms, mainly connecting patients. And this is not only about the access to the medical records, but also the access of an active network of providers. On top of that, as we would like to call them the payers, payers in specific are not just the insurance companies. This includes also the cell phone schemes, EPAs, HMOs, and even the discount card programs across the payer region. At the end, the third stakeholder that we are currently connected is the providers. And again, we are not only doing this for clinics. We have 5 platforms up and running for hospitals, clinics, pharmaceuticals, laboratory, and even radiology center. More importantly, and again, I want to emphasize on this, that we are not trying to replace or remove your existing system. What we're doing is a layer on top of your existing system. يعني let me for نديها كده بالعربي, think of it as InstaPay. But at the end of the day, InstaPay is doing an exchange of the financial records, بس بين البنوك وبعضها. So we are not replacing again the existing system. Let's say the HIS, LIS at your provider center. We're operating on top of that. We have been operational up and running, I think, for the last since March 22. So far, we're doing approximately more than 70,000 transactions. And by transaction, we mean visit, which is a patient visiting a provider. And we have 5 active payers, 500 providers, and we're serving so far approximately more than 250,000 patients. The model is a little bit, I would say, only flexible, but a little bit attractive to the payers, mainly because there is no license fee to be paid. So there is no upfront cost to be paid. As a payer, or even as a provider, it's a pay-as-you-go structure, so you can simply upload all your contracts. There's nothing to be paid. You only pay a fraction, which is 1 to 2% of maximum, from the claim that is actually done or conducted between the payer and the provider. So far, we're hopefully seeking not only a capital for growth, but more important, institutional partnerships. Again, we're not replacing your existing system. We're just aiming to do a layer on top of your existing system in order to facilitate the transactions at scale. So we're mainly aiming for direct enterprise integrations and hopefully going further when it comes to the medical tourism as well. We have a seed for 1 million. We approximately have already raised approximately 250 or 300K. We're looking for the rest. More than half of it will go to the engineering, since all products are already up and running at scale. We're just aiming to, I won't say stress more, but we need to comply more to the local regulations when it comes to governments specifically. That's it. Thank you.